scottgraypt.com. And so today is Manual Therapy Monday, and I want to talk specifically about the sub-occipital muscles and how we can influence those through manual therapy. And the reason why we want to work on these is because a lot of times tension headaches happen back there where that greater occipital nerve can be entrapped, but also just overall we get that forward head posture, which then throws off the mid-cervical spine, which then throws off the thoracic spine. So we're going to take a look at that and investigate that a little bit further. But before we do that, I want to kind of just brush up on the anatomy here. So this is a spine model. And you see here we got C2, which is where the inferior oblique goes and attaches up to C1 at the transverse process. And then you have C1, or the superior oblique, rather, that goes up to the occiput. And then from here you're going to have the rectus, capitis, posterior major, and minor down the middle there. So we're going to influence those through our manual therapy hands-on technique. So we'll go ahead and scoot up towards me. And so with your patient, you typically you don't want to just dive right into there because it's a really sensitive area. So you want to do just a couple courtesy distractions. You might do some gentle up glides just to get them relaxed. But from here I can just palpate C2. And from here I'm going to start him kind of in this extended position. And I'm going to take attention on those muscles. And I'm just going to have him do a quick chin tuck, so tuck your chin fully. And I just kind of support his head while I kind of take attention proximally towards the occiput to kind of get those muscles to relax there. I can also influence the inferior oblique. So I know with the same side rotator, I'm going to come right off C2 towards the transverse process, take attention on that muscle, and then just kind of bring it through a stretch as I kind of work on it. Similarly, I can also use a PNF technique, which is really good. So I start him in this kind of extended position, and then I have him go ahead and tuck his chin, and then I can have him just gently resist my hands, give him some contact, yep, and then relax, and then push, and then relax, and then push, and then relax. Good. So those are some very simple techniques that you can apply today and right now with all your patients. So give those a try. Let me know if you have any questions on those, and if you haven't already, please go to my website, scottgraypt.com, and download my physical examination blueprint where I show different strategies and techniques like this for clinicians.